Hello everyone. Welcome to Care to Heal channel. Having abdominal cramps? Having your period and it hurts so much? Then, this video is for you. Are you aware of dysmenorrhea, or others call it painful menstruation? Watch this video up to the end to understand your condition. Dysmenorrhea refers to painful menstruation and is one of the most common gynecological issues. It can range from mild discomfort to severe pain that interferes with daily activities. Dysmenorrhea is categorized into two types. The first type is called primary dysmenorrhea. The cause of this primary dysmenorrhea type is not associated with any underlying medical condition. It usually starts shortly after menarche or the first period and tends to lessen with age or after childbirth. What causes the uterus to contract? It is caused by the overproduction of prostaglandins, hormone-like substances that cause the uterus to contract. Prostaglandins are lipid compounds that have diverse-like effects on animals and human beings. They synthesized in the walls of blood vessels and prevents needless blood clot formations. They also regulate contractions of smooth muscle tissue. These contractions reduce blood flow to the uterine lining, causing pain. Now, let's talk about the symptoms. Cramping pain in the lower abdomen, usually starting a day or two before the period and lasting 2 to 3 days. Pain can radiate to the lower back and thighs. Nausea, vomiting, headaches, and diarrhea are sometimes present. The second type of dysmenorrhea is called secondary dysmenorrhea. This type usually is a result from underlying medical conditions. This results from underlying conditions like endometriosis, fibroids, pelvic inflammatory disease, PID, or adenomyosis. Onset: symptoms often start later in life, after years of painless periods or with a progressive worsening of symptoms. Symptoms: the pain typically begins earlier in the menstrual cycle and lasts longer than in primary dysmenorrhea. It may be accompanied by other signs related to the underlying condition, such as irregular bleeding or pelvic pain outside of menstruation. Let's talk about the risk factors. Early menarche, starting periods at a younger age. Long menstrual periods or heavy menstrual flow. Family history of dysmenorrhea. Lifestyle factors like stress, smoking, and a sedentary lifestyle. How to diagnose your dysmenorrhea? Dysmenorrhea is diagnosed based on the individual's symptoms, medical history, and physical exams. For secondary dysmenorrhea, doctors may recommend imaging tests, ultrasound, MRI, or diagnostic laparoscopy to identify any underlying conditions. How we can treat it? For primary dysmenorrhea, nonsteroidal anti-inflammatory drugs, NSAIDs, these reduce prostaglandin production and are often the first line of treatment. Hormonal treatments, birth control pills, patches, or intrauterine devices, IUDs, can reduce menstrual pain by controlling or stopping ovulation. Heat therapy, applying a heating pad or hot water bottle to the lower abdomen, can relieve pain. Lifestyle changes, regular exercise, adequate sleep, stress management, and dietary changes like reducing caffeine or increasing omega-3 intake may help. For secondary dysmenorrhea, the treatment is a bit different. Treatment focuses on addressing the underlying condition, which may involve surgery, for example, to remove fibroids or endometriosis, or specific medical therapies, like antibiotics for infections. How about the prognosis? What are the chances for you to get better? Primary dysmenorrhea generally improves with age or after childbirth. Secondary dysmenorrhea depends on the treatment of the underlying condition, but with proper care, symptoms can be managed effectively. Remember, healthy diet results in healthy living. Please support my channel so that I can continue to create educational videos like this. Click like and subscribe below. Thanks for watching.